तस्मै श्री गुरुवे नमः। तस्मै श्री गुरुवे नमः। तस्मै श्री गुरुवे नमः।
Good morning, all. How is everyone? Are you all well, fit and well, and not overdid with over the Christmas and Happy New Year? Yes?
All well.
Good, good.
Thank you,
Okay.
Panaji. Jai Shri
You're welcome,
Krishna.
Badane. Jai Shri Krishna, Badane. Okay. So, what have you remembered from Deepesh till now? What he has taught you? Anything? Or have you achieved all his exercise he's been teaching you? Yes? Anyway, Deepesh is there, so let's invite him. Deepesh, all yours.
Yes, Nainani. Thank you so much.
Happy New Year to you, and welcome back to this 2024. And hope to carry on. All
Same
yours.
to you all. Yeah, thank you.
No, not that one. No, this one. No, that
Good morning, all of you. Happy New Year to all. Today we will have a great session on low back pain. Low back pain exercises with routine conditions of the back, and low back pain exercises with the special conditions which are troubling us in day-to-day activities. Now, for that, first we have to understand that what is the low back pain exactly. The low back pain is the condition which is arising from your thoracic or thoracolumbar spine. This condition is known as low back area or low back pain conditions. A thoracic spine are T1 to T12 from backwards starts from here and ends on this point. After the thoracic area, after the thoracic part, we're having our low back or lumbar spine. It's a part of core. We have so many exercises for core strengthening. We have so many exercises for strengthen our low back, including the hip muscle, the groin region, knee region, and the thoracic spine. So first we have to understand that how to we get relief from exact low back area pain. What is the key to get relief from low back pain area? Exactly, it is basic simple stretches, including three stretches. First is a simple stretch or a simple rotation of the back with widen your leg. Simple rotation or rotation stretch. In this stretch or in this rotation, we have to take care about our leg length. It should be leg step length. It should be 1 meter away from each other. 1 meter away and widen your hands like this and give a simple rotation as much as you can on the both sides like this first and hold and on other side. This is a rotation stretch for low back pain. We will move towards our muscle energy techniques and the exercises which are exclusively designed for the low back area. But first, we will tell about the basic stretches of the back area. First was side stretch, which was a rotation stretch. Second is a gentle extension or backwards stretch. Second is gentle backward stretch. Backward stretch was like just place your hand on your back and give a gentle backward stretch and get normal. Again, backwards stretch towards the back. This stretch is not having any hold. This is no hold stretch. Yes. Again, a back stretch, straight, back stretch, straight. If you're having stiffness in your back due to change in weather, then your back and hip will move like this in a combination way, in a combined way. It's very normal. Don't try to pull your hip ahead from your back. It's a normal phenomena to bend your hip area also like this. You can do like this also. That is second stretch, or we can say a second normal warm up stretch for low back. Third, which is very important and is indicated for all low back pain patients, is side bend stretch. Side bend stretch is a stretch in which we have to maintain our trunk in a regular manner, in a regular way, in a straight way, but in a regular bending way. Not like this or this. This is not indicated for low back pain patients. Only a simple side bend with moving your hand towards your knee. This is the key for this stretch. Move your hand, move your hand towards your knee and get down on side. Yes, this is a standing stretch. So don't do in sitting. Again, stretch, side stretch, and hold. Sit. In this, you can give a hold to 2 to 3 seconds only. This is not a 10-second or 30-second hold exercise. Now, these were the basic warm up stretches for the low back pain condition. Now, I will explain you the stretches which are effectively related to the disc condition, to the stenosis, to the sciatica, or normal low back pain. We have designed a simple protocol for all of you to increase the effectivity of the pain in the simple way. I'll share you a slide. This is showing single knee fold with neck in flexion. This is a very effective stretch for sciatica condition. I'll explain you one by one all these steps. Sitting neck in extension is the second step. Knee to chest is third step. Fourth is self-correction techniques. In self-correction techniques, you have to correct your spine accordingly. Fifth is core strengthening. Although all are the part of core strengthening, apart from that, we will explain you exclusive core strengthening in next session. Next is hip muscle strengthening or hip muscle stretching. Fifth is postural and standing pattern. Postural and standing pattern is very important for all low back pain patients. First, I will explain you about single knee fold with neck in flexion. This is a very important stretch. You have to understand this stretch in a perfect manner. It's a systemic stretch. In this stretch, you have to flex your neck like this. My single leg is folded. My single leg is folded and next like second leg is extended. It means it is straight. First leg is folded. You have to lie down straight like this. Leg is folded and flex your neck like this and hold it for 10 seconds. One, two, three, four, five, six, 7, 8, 9, 10. Then relax. Again, this will go in this will go in flexion. Right.
Can you highlight yourself? It's not a very small picture.
Three,
We can't
four,
see.
6, 7, 8, 9, 10.
ના ના સારું સારું છે સારું છે હા હા
Better.
હા બસ એ જ વરસાદ ઠંડી ને ચાલે છે એવું છે
You able to see?
વેધર છે ને હા હા
Okay. First is single knee flex
કાંઈ વાંધો
and we have to flex this leg, extend the other leg, and flex your neck like this for 10 seconds. First is this, second is flex your leg, straighten your opposite leg, straighten your opposite leg, and flex your neck like this. One, two, three, 4, 5, 6, 7, 8, 9, 10. And relax like this. 5 from this leg and 5 from this leg. 5 on 5 from both the legs for low back pain. Next is sitting neck extension. Sitting neck extension. In sitting neck extension, yes. In sitting neck extension, you have to sit on chair or a stool. After sitting, you have to extend your neck like this and hold it for 10 seconds. One, two, three,
Again,
4.
sorry, again it's gone. Again your picture gone. It's gone again.
If can I advise? I don't know who that was, but can I advise you? Are you on iPad or a laptop?
iPad. iPad.
So you know when it goes when we are showing you uh, a second screen,
Mm-hmm.
in the middle somewhere you should have a bar across. You can size your visual. You can size your photo how big you want. For example, I've got half a screen showing the physiotherapy and half a screen I've got Deepesh. So it's a full screen. On my full screen, I can see two pictures, very same size.
Oh, I see. I don't know how to do. I don't know. A picture. Now there's participants. Sorry, now I don't know how to do.
So say in the middle of so if you can see physically therapy picture right now, and on your right hand side there's a bar there in the middle. at the
Uh,
end. At the
uh,
end. Can you see that?
no, no, that's what I'm trying to. There's nothing, no bar. There's only stop video or now now picture was big. Now it's gone again on the chairs. People were sitting on a chair. Oh dear, I don't know. Participants more. Let me have more
Okay.
than is.
At the moment, I can't teach you, but this will
All
be
right.
taught in our Digital Connect on
All
Monday.
right. Okay, okay, don't worry. I can see only
Sorry
in the
about
corner, very small Dr. Deepesh in the corner, right hand, very small one. Never mind, never mind.
sorry,
Okay,
Ashley.
may
Sorry.
yeah, maybe next time. Then when he'll show again, then I will
Yeah,
join again.
yeah.
Okay, thank you.
Now, sitting neck in extension is exercise which we have to do in sitting. We can do like this on sitting and extend our neck and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and straighten. This exercise is also related to our sciatic region, to our sacrum region, but it is completely contraindicated for the patients who are having vertigo or nauseatic uh, feeling with the neck movement. Third is knee to chest. Knee to chest is very important exercise, and we have explained this exercise in previous sessions also. In knee to chest, we have to hold our knee like this. We have to hold our knee like this. We can hold from here also. We have to hold our knee and stretch it from down to up towards our tummy and hold for 10 seconds. Then leave. Then next, again with the same pattern, hold for the 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is single knee to chest, which is almost indicated for all the back conditions, including sciatica. This stretch is like this. In this, we have to flex the other leg, and in this, we will flex the first leg. It means in this exercise, we don't need to straight our leg like this. We just have to maintain the flexion of the knees by which our core will get relaxed or our core will get a complete movement towards our tummy. Now, single knee to chest is a simple form and double knee to chest is an advanced form of this exercise or a modified form of this exercise. In double knee to chest, we will do stretch like this and hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. You don't need to lift your neck or middle or upper back in this exercise. It's a lower back exercise only. So you don't need to engage your mid back and upper back. Just stretch, hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax like this only. Now, I'll explain you the method or the pattern to getting up from the bed in a perfect manner in self-correction technique. In self-correction technique, we have to tuck our tummy. We have to tuck our tummy during getting up from the bed. It's a normal phenomena to get up from the bed with a sideline pattern, but it's a perfect phenomena. It's a perfect technique to tuck your tummy and get sideline, then getting up from the bed like this. I'll explain you how to get up from the bed. For example, you're lying down like this. You just have to tuck your tummy, tuck tummy. In tucking up the tummy, you have to squeeze your tummy inside. Tucking up tummy, it means you are squeezing your tummy inside. Tuck your tummy inside. Get on sideline. Take your hand rest and lift from the bed and get up from the bed and release your tummy. This is a very good method for self-correction technique in all of the back pain cases, including sciatica and slip disc. Next is core strengthening. Core strengthening part is all combined part. I'll explain you a few more exercises of this. Next is hip muscle strengthening in postural and standing pattern. In hip muscle strengthening, always we have to see our hip area. This is the hip area. Sometimes our hip area get tilted from one side and get hiked from other side. This is very normal in low back pain. In low back pain, there are so many associated conditions which can cause back pain plus hip pain plus groin area or the pain in the knees area. So hip strengthening is very much important. We will explain you the hip stretches first, then we will explain you the hip strengthening. In hip stretch, first stretch is seated piriformis stretch. This stretch is especially designed for the patients who are not able to do all the exercises in supine or in the lie down condition. In this stretch, first step is this, in which we are maintaining our back posture erect on chair. Second, you have to keep your ankle on other knee. You have to keep your ankle on other knee. This should be movable. This area should be movable. If this area is not moving, it means your hip is not getting relaxed by this position. This area should be relaxed completely. This is a hip stretch or a piriformis. Piriformis is a muscle of hip. Piriformis stretch with mobility. With mobility means you're doing downward stretch with forward bending. You're doing downward stretch with forward bending like this. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Opposite stretch. The movement is very same. The mobility of the back to do this stretch, but we have moved to an advanced form of the mobility or the stretch of the piriformis muscle like this. Hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Same with the other leg like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Back mobility is very important in this exercise. In mobility of the back, you will feel a basic stretch on your low back or lower abdomen area. It is completely normal because you are doing a stretching exercise for low back pain. You can do it on a stool, on a chair, on a bed also with proper support on both of the hips. You should get seated completely on the chair, not a single or corner stretch. This is a knee to chest exercise. You can see here it's a sort of piriformis or a knee to chest combination exercise. In this exercise, a patient gets folded leg on the other and is stretching opposite leg towards the tummy area. This is a piriformis knee to chest. In this knee to chest, we are doing knee to chest exercise plus piriformis exercise. This is a combination of two exercise. That was the seated piriformis stretch. Now, this is a very important exercise for the patients who are having hip pain plus back pain. This is very, very, very important exercise and get you will get relief instantly from this exercise from your low back area or from the hip area pain. I'll explain you first theoretically, then I'll demonstrate you this exercise. In the start position, you have to keep a single pillow between your legs, between your thighs and your knees. After the placement of the pillow, you have to downwards move your opposite leg or the leg which is upward. You have to downwards your movement. You have to give movement to the opposite leg towards the downside or the above leg towards the downside. After the starting phase, just hold it for 10 seconds. After the period of 10 seconds, lift your leg and move towards the finish area. In finish area, you don't need to press the pillow. This pillow is only for maintaining gap between the both legs and knees. This is not for pressing up. Again, I am explaining you. This is not for the pressing up. In the finish phase, you will lift your leg opposite and ankle towards the sky, towards the upwards movement. I'll explain you how to do this exercise. This is very important exercise for low back plus hip patients. First, initially, you have to place a pillow like this. Let us place a pillow like this. You have to do this exercise both the sides, from the left also, from the right also. This is only for a reference. This pillow is only for reference. It is not for compression. It is not for the exercise form. You have to lift your leg and hang it on like this, above from the pillow and towards downside, and hold it for 30 seconds. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 30 seconds towards the down area, towards the floor. This will give you stretch over your hip area. This will give you stretch over the hip area. After the 30 second, you have to lift your leg like this and move towards upwards. In upward movement, in upward movement, you have to see your ankle. In upward movement, you have to see your ankle. You have to maintain both the knees like this in a single alignment. You just have to lift your ankle, not the knee. You have to lift your ankle, not the knee, like this and hold it for 30 seconds. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then relax. Each side three times. 30 seconds on the floor side, 30 seconds on the sky side with the left leg, and 30 seconds three times on the opposite. On the opposite, you can do on this side. Again, this pillow is only for the reference. This is not for the exercise purpose. It is indicated for all the chronic cases of the hip pain, chronic cases of the back pain. It is contraindicated for the patients who are having vertigo, the patients who are having acute disc bulge or acute episodes of sciatica, patients who are having history of surgery on the hip or back surgical cases. All the exercises are contraindicated for post-surgical cases. Now, next exercise is back care with complete hip conditioning. Back care with complete hip conditioning. In this, we are using a weight cuff on the ankle area, but you don't need to use any weight cuff on ankle area because we are explaining about normal baseline exercises for getting relief from the back. So we can do this exercise on prone line with the support towards the tummy, with the support towards the tummy, and move your legs, fold your legs to 90-degree, holding the legs, holding the hip plus knee joint 90-degree, and lifting up and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Why we are using pillow over here? Because when we will use pillow on this area, our back area and hip area get completely stretch separation, and we will get a good stretch over this area, which will improve your functionality of the back and the hip joint. Again, this is not indicated for hip patients who are having surgical histories or patients who are having avascular necrosis on the hip joint. You have to place pillow like this. You can do like this also. This also. This is also a proper positioning. If you will do like this is not a good pattern. This is not a correct pattern. You may get hurt. You have to flex your leg like this first, then lift. One, two, three, 4, 5, 6, 7, 8, 9, 10. With opposite leg, you have to flex first, then lift. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's a normal movement. It's a normal uh, upstance phase in this exercise. The knee and the quadriceps area is getting lifted, and this exercise is up to 1.5 or 2 inches only. Next is high and low bridge. High and low bridge are very easy to do and effective for back pain relief, but it is not indicated for acute cases. What is the difference between high bridge and low bridge? In high bridge, we will engage our mid back muscle and lower thigh muscle also. And in low bridge, we will just engage our core area. So, both the bridges are indicated for the back pain patients, including muscle energy techniques. In this, we can use so many muscle energy techniques also. We will take that session in further sessions. In this, you have to stabilize your core in low and in high bridge, in both of the bridges. I'll explain you how to take both the bridges. In bridging exercise, you can use pillow. Widen up your leg like this. Stuck. Concentrate on your core area. Tuck your tummy a little bit and give a single lift. It's a single lift and a low bridge. One, two, three, four, five, six, seven, eight, nine, 10. This is a low bridge exercise, especially for core strengthening. It's a very important part of core strengthening. In a high bridge, in a low bridge, you have to maintain like this. In a high bridge, like this, you have to maintain. Take support of your arm and forearm on sides. You don't need to tuck your tummy in high bridge. The difference between high and low bridge, in high bridge, you don't need to tuck your tummy because in high bridge you will get stuck on the above manner with the erection of the back from the back side like this. This is high bridge. You will get stretch over the thoracic area also. Don't need to do like this because this is not indicated for high bridge. This is indicated for high bridge. And hold it 10 seconds, then down. This is a bridging exercise. I'll explain you the indication and contraindication of this exercises also. Now, next is partial curl or rectus curl. Partial in this partial curl or rectus curl, you have to do like this. You have to maintain your posture like this and get a simple stretch towards forward movement. Stabilize your neck, stabilize your neck to like this, and after placement of your hand, stretch your tummy, tuck your tummy, and get up forward. This is also a 10-second stretch. You have to place your hand like this. You can cross like this also. But this is a normal and feminine phenomena. Stretch 1, 2, 3, 4, 5, 6, 7, 8, 9. This is a partial curve, important for all the practice conditions for the back pain, which is related to the core area, to stabilizing the core. Now, very important part for standing and hip hiking area and the hip hiking position. You have to understand that what is hip hiking. If you are walking like this, it's a normal walk. If you're walking like this, it means you're hiking your hip height on one side. This is known as hip hiking. In this hip hiking, we have to give three pattern of the back exercise. We have to give a simple three stretches or three conditioning to the back area. First, which is very important, is self correction. How to get correct self by this pattern? We have to see the area of the pelvic which is moving towards upside. You have to see your pelvic area which is moving towards upside. You can check the area of your back dimples. You can feel the area little bit difference, or you can check with the ruler or normal scale or normal erect board and check the area where the hip is getting up. this area. This is a spine. This is our hip area. If you are having hip hiking, your hip will get hiked on one side like this. Or you can check in front of mirror pattern of your walking. If you're walking like this, it means you're hiking your right hip, and if you're walking like this, means you're hiking your left hip. Now we have diagnosed the hip hiking. Now we have to check. We have to give a basic threshold to the opposite hip, which is not hiked, which is not moving upwards. How to give? For that, we have to use a stepper, or we have to use a basic uh, support on the floor for the reducing our hip hiking. I'll explain you how to use this. I'm using a support for reducing my hip hiking. If my right side hip is hiked, if my right side hip hip is hiked, I'll use my left side. If my right side hip is hiked, then I'll use my left side. I'll use my left side like this and hang on this, and left on right side. You have to hide your hip with a simple stretch. My right side hip is high. I'm using this and hiking this more towards the left, giving the pressure on the left hip. Same with the right hip. Same with the right hip. I'm having left side hip hike. Left side hip hike. So I have to give pressure on the right side like this. This movement is upwards movement. This movement is upwards movement. You have to do this very carefully. I'll share you the picture of this exercise also, so you can understand better. Hip hiking for low back pain. You can do this with the support of a stepper or with the support of any bar on the floor. With this support, you can correct your hip hiking. If you are not able to understand then which hip is hiking or which is not, then give a simple stretch towards up and down, which is explained in this diagram also. In this diagram, the patient is doing hip hiking and downwards movement of the leg on the up and down, both the sides. You have to do this exercise both the side, up and down, up and down, up and down. This is a very important exercise for hip hiking patients or patients having pain with the hip joint pain. And this is contraindicated for all the acute cases or the cases get operated previously. So this is indicated for only chronic back pain or for only back pain which is not in acute phase. You have to do it carefully with the support. If you'll get slipped, then you may get hurt on your hip only, because this is a balancing exercise. This you can do with the support of stairs bar also, or with the support of gate, but you have to do this exercise very, very, very carefully. This is hip hiking for low back pain. Now in self-correction technique, I will tell you two and three steps to get corrected. on the support of wall. Basic 2 and 3 steps are like you have to widen up your hands like this, support it, get away from the wall and stretch it towards the wall and hold, then backward and hold and backward. This is for upper and mid back. This is for upper and mid back. Now, for the low back correction, for the low back correction, you can do like this. Extend your neck and extend your back. Hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In this, what is the difference between first warm up which we have done and this? This is a exercise form and having 10 seconds hold, and first one was which we are doing in rotation, backward movement, and side bending is not having any hold. Side bending is having hold, but others are not having any hold in the form of exercise. That was the part of warm up, and this is the form of exercise of self correction. Now you can do so many things to correct your back, like this stretch, forward bending, shoulder shrugs exercises, so many of the exercises. But this wall exercise is very effective for your upper back. If you will do this exercise in a correct way, hold properly and move towards the wall properly, means you are getting erect or the erection of the shoulder is happening here with the correction stretching exercises. After the self correction, you have to do all the basic exercises of the low back, including knee to chest exercise, side bending exercise, twisting exercise, plus core strengthening exercise with bridges, high and low both. Now that's it for today. If you have any questions, then you may ask.